Now we're going to go to two activists who are in Germany, Miranda and Paula. Miranda's going to start by giving us a sense of the general situation in Germany, and then Paula will speak about her organizing with workers in transit and hospitals in Berlin. So thank you, Miranda.
Yes, hello to everybody. And yes, I will start with an introduction about situation in Germany, and then Paula will talk about more the hospital sector, the health sector. And yes, I hope it will be interesting for the discussions. So here I start only with some figures about Germany and COVID-19 cases. So here you see a map. You have Germany here, obviously, and this is France. And we have Austria. It's the country we just talked about. So Austria, you see, is in the south. And here we have Germany. And the different colors show that the regions in Germany are differently affected by the virus. So deep blue means these are the hotspots in Germany. So this is Bavaria and Baden-Württemberg. These are very industrialized regions in Germany. It's really the car industry and manufacturing industry, especially here, Stuttgart, this is Daimler, yeah, Daimler, Mercedes, Volkswagen, you know. And the other region is here, it's Nordrhein-Westfalen. It's what we call Ruhrgebiet. It's very industrialized, it's manufacturing industry, car industry, chemical industry. So these regions were very much infected. So me and Paula, we are activists in Berlin. Here you see it's not the same. So the numbers of COVID-19 cases are really much lower in Berlin than in other regions. And generally, when you compare with other countries, and especially France or the US, it's really true. It's not fake news, yeah, that the cases are much lower in Germany. So here you see the confirmed cases now, today. It's 137,000. And this is the death toll, so 4,110 people died from COVID-19. So when you compare with other countries, it's really not the same. And here you can see the curve, our curve, and the curve in Germany. And what is interesting is that it's like Austria, that in Germany the government and the federal states, they started quite early with the measures. So it started in Germany more or less 12th of March. So when the numbers were really low, yeah, 12th of March. And since the 22nd of March, we have a kind of confinement until now. So confinement, it's not that it's really strictly forbidden to leave your apartment. You can, so there are a lot of exceptions. You can leave your apartment to do sports in the open air. I don't know if it's a special German thing, but they really underlined it, that it's allowed, yeah, to have some sports, but only alone. You can even sit in parks, and of course, very important, you can go to work. So it's a bit dystopic situation, but not that harsh like when you compare with France. Of course, there were some cities or neighborhoods with quarantine very fast. They started very fast, but it's not the case for whole Germany. So this confinement means that really shops are closed, the schools are closed, universities, cities, theaters, cinemas, and yes, but not the factories, and until now. So, and these social distancing measures were accompanied by the same melody we have everywhere, with the unity and solidarity. We have to stand together, and the unions and the bosses, they strengthened their social partnership. So that's the music we have. So for the working class, what does it mean? So a lot of workers were sent home. So we have hundreds of thousands of people working from home office. But of course, it's not for everybody. It's for people working in administration, engineers, and so on. And even to work at home, it's not very nice, and also a lot of exploitation and very difficult. But for the factories, for the main workplaces, they continued working. they continued producing. It was the case for Volkswagen and Daimler and BMW. And now they closed some factories, but it's not because they take care of the health of their workforce, of course not. The problem is, of course, that the whole industry is affected by the virus. So there's a lack of parts and materials. So that's the reason why they closed some factories. I don't have really numbers, yeah, how much is it really, yeah. But what I heard from Volkswagen, they closed some factories only for 2 or 3 weeks. So it's not very much. They use the time to reorganize the production and to restart, to reboot, yeah, the production as soon as possible. That's really what they are thinking about. So, but on the other hand, I heard that there were some resistance by workers in Volkswagen and for sure in other workplaces too, because it was strange that the management or the administration, they could work from home, yeah, in safe conditions, but for the workers to work along the assembly lines, of course, it was very obvious, yeah. So it's also a reason why some factories closed, but I don't know exactly how much resistance was there really, but sure there was something. But other companies reacted with safety measures. So I know, especially for Siemens in Berlin, they changed the shifts so that the shifts don't meet each other in the canteens where you get food. You have to sit alone at your table. So it's really also very dystopic when you imagine that this is maybe our future. Yeah, you have to eat alone in your break. That's really kind of horror, yes. So, but other companies reacted very reluctantly. So like for the train sector, it really took a long time that the workers got even the minimum of some safety stuff, like for disinfection. Yeah, so actually you had to change a lot in the organization, especially for train drivers or for all the people working on trains. And but there's like nothing. Yeah, it's really a problem. It's really a criminal what's going on there. So, but even though there are stories from train drivers who stopped, who avoided to continue training of the colleagues. So then when you do the training, you are really close together. So they stopped it. They said, okay, I will not continue. Others try to get some distance to the people, yeah, to get not infected. So these are little stories, and it's not so easy to know these little things, this little kind of resistance, but it happens. So I will a bit come to the companies and what they really try and what is their idea towards the working class. So I will switch. I hope it will manage. Can you see it? No. Okay. Stop
Not
share.
yet.
Yes, I will change. So I will come back to this one. Okay, I hope. Changed? Super.
Yes,
okay.
Good. Yeah.
Okay, so for the economy, you can imagine that they talk about recession. That's true, that it has a big impact. So this is to show you the expectations in decreasing of the economy. So the deep blue here, 7.5% is the expectation for Europe. So you see it's minus 7.5. Yellow is USA. And light blue is the world, and red is China. So this is the horror for the European industry. Yeah, this drop in 2020, and of course they will try everything to come back to growth rates like you see 4.7%. So it's more than in 2019. Yeah, so they don't want to just restart the economy. They really want to I hope it's the right word, to make up for losses. Yeah, they will want to minimum the losses they have this year. And you can see it here. I show you. I like it. It's in German. Sorry, but It's something made by so-called scientists, economic scientists. There are a lot of them, and this is by an institute who is financed by the corporations. But they all say the same in Germany. So they make such a pressure, since weeks, such a pressure on the politicians and the governments to restart economy. And here you see, it's a positive scenario. It's a positive scenario. It starts with 100% in January. You have the drop in April. And they say, okay, when the government stops the social distance measures in April or the end of April and reboot economy, then whoosh, you see, it will grow and it will come up to 115%. So black is the industry, yeah? And to come back to 100% at the end of the year. So this is when they lower the measures at the end of April. And then you have a negative scenario, yeah, saying, okay, when these measures last until June, then you see the industry, it will grow slowly and it will have big losses and so on. So this is what all the economists say when they give advice to the government. And we had a lot of these papers around Easter. And no surprise that, yes, what happened just last Wednesday, just some days ago. The government, the German government, the chancellor and the head of the federal states announced that they will start in, I call it the post-corona times, at the beginning of May, 3rd of May. So they will start to open small shops from right now. And what is really incredible, it's like in France, they will start to reopen schools. And it will they will start next Monday. So nothing is prepared. So the teachers, this weekend, they try to organize something. Nobody knows really. And the pretext is that they have to write their examen. But yes, sorry, I will really trust it's the exam. Of course, it has nothing to do with the exam. It's really that under the pressure of the economy. Because how can you bring back the parents to work when you don't have the kids at school? So, and this is really incredible. The protest started immediately. There are the unions writing petitions. There are pupil organizations starting on Facebook, on WhatsApp. They're starting with something. So we will see in the next days. I hope it will grow. And they are right. They say very clear that there's nothing organized, no minimum. Yeah, you need rooms, you need teachers, you need cleaning. And how can you organize children at the age of 10, 12, 14 to keep the social distance? It really makes no sense. So what we really fear is a second wave of the infection. So then a short look what's going on in the economy, some other aspects. This is a sheet, it's from the Federation of the German Employees Association for Metal and Electrical Industry. And what is their problem? Their problem is not the health, of course, the health of the population, especially the working class. What they fear is, you see, this is a decline in, that's a problem of the capacity utilization. So they compare with 2009. You see 2009, the crisis, then the capacity, blah, blah, blah. And now we are here. And that's their problem. Yeah, their problem is that they want to make their profits. And they don't have enough orders. And that's very clear. And that's another thing I find quite interesting because it's this federation asked the companies, okay, what is your problem? And this is the question, okay, what is the reason for the stoppage? Why you stopped the production? And the companies answered, okay, 57% is because of a lack of demands. This is here, lack of demands. And this I found interesting is 36% is lack of workforce. And what is the problem with the workforce? They talk about sickness. But the sickness, you must know that it doesn't mean that all the workers are sick, yes? In Germany, you get 6 weeks paid when you are sick. So, and for a lot of workers to get sick, I mean, not really sick, but is to avoid unsafe working conditions. That's the reaction of a lot of workers. Yeah, they go to the doctors and they are paid for weeks. And the other thing is childcare. That's what I said, just already said. Yeah, childcare. So the parents are at home, and so the problem for the economy is find a solution for childcare. So this is 32% lack of material and parts, and only 10% is because of health. Yeah, this is shut down because of health reasons. So these are the problems for the economy. So, and then I will come to the problems for the working class. So one of the answers of the corporations is what Uli already said is forced short-time work. So this is about the metal industry, and it said that already 43% of all the companies use short-time work. That's huge. And there will be another 40% who thinking about or planning forced short-time work. So it's a huge effect on the working class in Germany. It's already 1.2 million in just only in the metal industry. So imagine there are a lot of other branches, and already 750,000 companies announced short-time work. It's incredible. It's much more than in 2009. And even though when the workers don't work zero hours, even when they work 60% or 50%, it means also a huge loss in wages, especially for the precarious jobs. And we have a big precarious sector in Germany. Yes, and there's not so much and I know from the US that they like Germany and talking about the good situation in Germany, but we really have precarious jobs. So when you get only 60%, yes, then you lose a lot of money. On the other hand, we had stimulus packages too for the economy, 600 billion euros right now, but we know it's only the beginning. And the other thing is, so I told you that the corporations, the way to restart. So we had changes in law, especially in the law for working hours. So now 12-hour shifts are possible. And for the moment, it addresses only the health sector and transport and food trade, and so these special sectors. But we all expect that they will extend it to other branches, and not only until June, but yeah, for the next time. So Corona will only be the pretext. So to come to a conclusion, yes, the corporations are ready to go in Germany. Yeah, the problem is schools and kindergartens, and to solve the problems with safety conditions at the workplaces. That's what they will organize in the next 2 weeks. And then we will see a huge competition. So who will be the first, yeah, in Europe? Who will be the first, and how will the workers react? Because it's so obvious that all these measures are really made for the companies. It's really yeah, incredible and injustice. So I give to Paula.
So I'm Paula from Berlin, Germany, and thank you for inviting me today. And I will shortly talk about the German healthcare sector and the situation in the hospitals during the COVID-19 crisis. Like everywhere, there have been big cuts in the healthcare systems during the last years, and especially since the early 2000s, a reform changed the financing of healthcare in Germany. So the government introduced a so-called diagnosis-related groups, shortly DRGs, which are basically case-based lump sums. So I hope this is the right word. So I checked it in the dictionary, but I hope you know what I mean with it. And this DRGs means that the insurance pay only a defined sum for a disease or for a sickness. And if the patient costs more, for example, because there were unforeseeable complications, the hospital has to cover this cost. And one of the consequences of these cuts were a decrease of nurses in hospitals and in the nursing homes. So the number of nurses decreased steadily. while we have more and more doctors. So damn it. A moment. Yes, so here you see a figure about staff development in the last years from 2000 to 2016. And in blue, you can see there was a slight decrease for the nurses. This is just only in the hospitals. And huge decrease for the doctors. And there was also an increase of the medical cases during the years. Yeah. So, and yeah. At the moment, there are an average 13 patients per nurse in the hospitals. And I have heard from nurses I know that they have to take care sometimes over 30 patients alone, for example, during the night shift. Anyway, there was one positive effect or side effect of this case-based lump sums. So Germany has now the highest number of ventilators of around 30,000 machines and care beds in Europe, because this is a medical case which gives the hospitals a lot of money. So they get a lot of these machines. But we face the problem at the moment that we can't use all these machines because we have a lack of trained nurses and staff who can take with that machines. Also, we have a severe lack of protection material like masks and lab coats. Nurses are faced to wear one-time masks several times over many hours and for many stations. And we have weird recommendations appearing how to clean your mask at home, how to wash them, and how to make them safe again. And I think you know all the stories about the lack of protection material in the United States too, so I won't say so much about it anymore. But another big consequence of the reforms of 2000 were also that Germany don't have enough material, like in their, so like 30 years ago, we have big stocks of protection materials somewhere stored in Germany. So when we have a crisis, we could use it, but they reduced these stocks. And they also reduced the number of nurses who can take care of this material or can take care of the machine because it's cost a lot of money. And I was also thinking that maybe some of you are wondering why our infection rate for Corona is so low at the moment here. And I just checked it for today, and at the moment we have about 2.4% in infection rate in Germany, whereas in Italy you have a rate of around 13%, and in the United States is at the moment around 4%, what I read at least in the German media. And why we have such a low rate is, I think there are several reasons for it. So one of the reasons is that we have this high amount of intensive care beds, which I already talked about it. And then another reason is that we have a public healthcare insurance. That means all the people or the citizens of Germany are required to have a healthcare insurance, which is paid by the employer and by the worker, or which is paid also by the state if you are unemployed. And so that means all the German citizens can go to the doctor, they can get a checkup without paying for it, they can also get treatment without actually paying for it. And so the people also really go to the doctors if they feel sick or if they have the feeling they got the coronavirus. Another reason is that our testing rate in Germany is quite high, or like one of the highest in Europe. We have around 350,000 tests per week. And in average, we have around 11,000 tests per 1 million inhabitants, which you can also see here in this table. So you have some comparison for Germany, Italy, South Korea, Spain, the United States, France, and Great Britain. And yeah, so I think also the number in the United States are increasing at the moment, but the number of tests per 1 million inhabitants are still around 3,500. Yeah, so in the end, we have just a higher number of positive tested people, and probably we have a comparable number of people dying in Germany, but because we just test more people, we get a better rate. So this is, in the end, this is math. And now a few more words to how the German government is answering to this crisis, especially in the healthcare sector. So last year we got a law for minimum staffing in some areas of the hospitals. And this law was passed already in the beginning of March. Even in the beginning of March, there were not a lot of corona cases. So they really started really early to get this little bit what we have to reduce it. In contrast, we have also some private hospitals who wants to send their nurses into this short time work. Because this private hospital is doing mostly stuff like plastic surgeries or other treatments, operation which brings a lot of money. And intensive care is normally not an area which brings a lot of money in the German healthcare system. So in the end, so if you want to know more, we can also keep in touch. Just write me a private message if you want to know more about the nursing or healthcare sector in Germany. But in the end, we also have some few movements already organized in the German healthcare sector, so nurses getting together. I hope that after the crisis, there will be more what we could organize. And thank you for your attention.